I'm Dr. Mike Halstead. I graduated from the medical center here in Omaha in 1984 after completing my training in medical school, and then went to Dallas, Texas at the University of Texas Southwestern Medical Center for my internship and residency training and then subsequent fellowship training in ophthalmology. The most common things that I treat are basically cataracts and diseases of the cornea which require corneal transplantation. But we also in the practice all provide routine care, so the fitting of contact lenses and glasses, and that takes a great deal of our time as well. So we provide a broad spectrum of care. One of the facets that the University Med Center provides for me in my practice is the ability for their microbiology laboratory studies, because my particular area of interest is in treating external diseases of the eye and corneal infections. The lab here at the Med Center is by far, in my opinion, the best in the city. They provide outstanding service, and it's just a great relationship. Also, from the consultative standpoint, if we need expertise outside of the realm of the darn practice, that the university provides great resources, particularly for our low vision patients in their low vision center. So it's a good relationship for those of us that are here at Midwest Eye Care who are in private practice, to be able to intermesh with the subspecialty areas that we are not necessarily able to provide in our own practice. My dad was trained as a pharmaceutical chemist and was in pharmaceutical production for veterinary products. So there was that bent towards science throughout my grade school, junior high, and high school careers. And so in addition to that, had good relationships with primary care physicians growing up. Actually did a science fair project in 8th grade where my primary care physician helped me do it and ended up winning second in the state. In terms of getting interested in ophthalmology, one of my best friends in junior high and high school was the son actually of our second partner of this practice, Dr. Richard Meisner, and so throughout my junior high and high school years I was around their house and became interested in what he was doing, and ultimately led into my interest in ophthalmology. The nicest thing about ophthalmology is you get the best of both worlds. I love the surgical aspects of my practice, and fortunately most of the things that we surgically intervene on are very successful procedures. So restoring sight from cataract surgery or corneal transplants is very rewarding, but in the same breath I love taking care of patients that I've seen over my 25 years of practice. And so I have, just yesterday, saw a patient who I started with when she was 8 years old and is now getting into her early 30s and just getting married, and we just have a great relationship.